I'm your host, Dr. Stephen Katz, alongside with my co-host, Dr. Loreena Ryder. We are licensed naturopathic physicians. We're so happy you could join us today. We're here to help you navigate your journey to wellness, but we're going to do it simply, without all the confusing medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allow your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back. Now, a common question we always have is, what is a naturopathic doctor?
Hi, this is Dr. Loreena Ryder, and I'd like to just give you a little bit of an insight on what a naturopathic doctor is. We are medical doctors, and we try to treat you with a natural approach first. Obviously, we can use conventional treatments if necessary, but we like to go naturally first. So we do a full intake. Typically takes about an hour, and we do some really great investigative work as to what the cause of your issues are to begin with. And rather than just treat the symptoms, we go to the root cause of that problem, and that's what we treat.
You have to know the cause in order to treat the problem. So what's a visit like when you see a naturopathic doctor?
So you'll see us for 1 hour, and we do a lot of questions. Most of my patients will say, oh, nobody's ever asked me that before. How many times are you pooping a day? That's something that I like to know, because what goes in should equal what comes out. And then, that tells a lot about a person, right?
Both with food too.
Yeah. The food, right. And then finding the root cause of the problem, that's the basis of why you're having that issue to begin with. So
now when you see a naturopathic doctor, you actually see the naturopathic doctor. When you go to conventional medicine, a lot of times you're stuck with the PA or the assistant. You get your 5 minutes, 3 minutes, if you're lucky, 7 minutes.
Yeah, the time difference is a really big deal. And I find that the longer the patient is sitting there in front of you, the more they're relaxing. White coat syndrome is a real thing.
It absolutely is. White coat syndrome is when your blood pressure goes up when they're testing you at the doctor's office. Patients all the time will get tested and they're 20 points higher than normal, and their doctor thinks they have high blood pressure.
Right. Off you go with the blood pressure medication.
It's just that they're nervous to see their doctor.
Right.
We wear black in our office. You can't get white coat syndrome in our office.
Good point. Yeah, no white coats in our office. We try to make our patients feel comfortable. And we also, what we focus on is prevention. So we focus on prevention as the best form of the cure, because if you can prevent that problem to begin with, then you don't have to kind of backpedal to fix it.
And we love to teach. Doctor as teacher is one of the naturopathic principles. We don't want you just to get better. We want you to stay better.
Yeah.
We all have a brain. How's your brain doing today?
My brain is great. I am not scarecrow today.
That's good. So on today's episode, we're going to go over all things brain health related. Think about the symptoms that are most common with brain health.
Yeah, so if you're experiencing anything like anxiety, depression, brain fog, which would present as memory loss, lack of focus, if you've been diagnosed with ADHD, or you're just having some simple fatigue, those are some of the symptoms that would be associated with brain health.
So most people will have in their life some experience with any of these symptoms. Anxiety is probably one of the most common ones. Do you have anxiety?
Sometimes. I have a brand new car payment, so yes, I have anxiety about that.
Yeah, and I'm married with kids.
Oh my gosh.
I have to bring them up every week.
Of course, yeah, they love you.
But anxiety is very common, and it's not just your day-to-day stuff. Situational anxiety is pretty normal. Work, school, payments, those are pretty common. It's when they turn into panic attacks and random just bad days.
Yeah, life disruptors. If you have a symptom that's disrupting your life, that's when it's a problem, and that's when you need to seek treatment for that.
And with depression, you used to enjoy life. You don't want to do those things anymore. Things you used to enjoy, you don't enjoy anymore. Going out of your house becomes more challenging.
Yeah, and having just general lack of motivation of even getting out of bed.
And then brain fog. I used to remember everybody's names as a common thing we hear. I always forget where I put the car keys. I never did that before. I'm just not quite as sharp as I used to be.
Right. Walking upstairs and forgetting why you went there, turn around, come back down, try to figure that out. Those are things that we're talking about when it comes to brain fog and just a little bit of memory loss.
And the ADHD that probably half the country thinks they have, that ADHD is attention deficit hyperactive disorder. They are wired all the time. They can't stop, relax, and focus. There's a lot of heavy-duty treatments that they've been given in the past, and they don't want to necessarily be on those, and we'll get into more detail. But in general, the lack of focus, the ADHD, oftentimes can be really easy to treat.
Yeah, absolutely. And that's something that we're really great at as naturopathic physicians. We love to dig in and figure out what's going on there with you, whether it is the anxiety or depression. And honestly, that can be a combination of both.
So if you're having anxiety or depression, brain fog, even insomnia is a really very common thing that is associated with the brain, but the causes of the insomnia are many different things.
Yeah, and so we're really great investigators when it comes to what is causing this. And we had talked about that a little bit earlier as to what a naturopathic doctor is. And we basically we Sherlock Holmes it.
Yeah, and with all these symptoms, with, brain health, you have to do the correct investigative test to find the cause of them. It's not as simple as just here's a pill to treat the symptom. We try to avoid the pills or get you off of those pills.
Yeah, we appreciate you tuning into Your Health is Wealth today on Money Radio. This is Dr. Loreena Ryder and Dr. Stephen Katz. We are licensed naturopathic physicians. On our weekly show, Your Health is Wealth, we're here to give you some practical information, and we help you take charge of your health and really become an advocate for your own health and get your journey to your life back. If you're struggling with your day-to-day tasks, say if forget where you put some things and you're just really frustrated, or if it's affecting your work life or even your home and personal life, if everything just seems harder than it should be or it used to be, we're here to help. Our office is located at Naturopathic Physicians Group 9200 East Raintree Drive in Scottsdale. You can find us on the web at www.naturopathicgroup.com, or you can call us at 480-451-6161.
We'll be right back after this quick break to start talking about why your brain is not working like it used to.
Welcome back to Your Health is Wealth here on Money Radio, 1510 AM, 105.3 FM. I'm Dr. Loreena Ryder, and I'm here with my co-host, Dr. Stephen Katz. We are naturopathic physicians. We're live today and every Friday at 1 p.m. We discuss a different topic for natural remedies for your health every week. Today's topic is brain health and how it works or how it does not work.
So every week we have a topic, and as Dr. Ryder just said, this week it's brain health. So earlier we were talking about the most common symptoms people get with brain health: anxiety, depression, brain fog, memory loss, lack of focus. Do we ever get lack of focus?
Never. No, I'm kidding. We totally do.
We're human too. And then fatigue is also a very common one. So every week I do a segment called What Isn't Your Doctor Telling You? Now, this is not a segment to be anti-doctor. It's not that the doctors don't want to tell you everything. It's just in a short visit, when you're getting your 3 or 5 minute visit, there's a lot of missing information that actually happens. So this segment is really just to give you information that you may or may not have heard of when dealing with it. So with brain health, one of the things I really talk with all of my patients about is when you're on medications to treat your symptoms of anxiety or depression, when you're given those meds, oftentimes they're actually guessing at which one's going to be the correct medication for you. It's a guess because they're going strictly off symptoms. Like we talked about in every segment we've done this show, it's always about the cause. If you don't know what's going wrong in the chemistry of your brain, then every treatment you will ever do is based on symptoms.
Right. And it just seems a little bit inefficient, because why would you waste time, money, and maybe even make the symptoms worse by guessing at treatment?
And we definitely tell people, don't go to the grocery store and guess yourself either, because you're going to see a different bottle everywhere that says this treats anxiety. What's the difference between them could be very different on how it actually treats the anxiety.
Absolutely. Yeah, that's a really good point. And we get that question a lot, even with foods. What's the difference between this food and this food? They're labeled the same, but one may affect you differently than the other. It's the same thing with medication or any other thing that you put into your mouth.
Yeah, not all noodles are the same.
That's right.
And when you're dealing with, the guessing part, the main reason for that is they don't generally run tests to determine your brain chemistry.
Yeah, so let's talk a little bit about what traditional diagnostic tests are ran whenever it's looking at your brain health. And they are valuable. It helps rule out certain things. So your doctor might run comprehensive blood serum labs. They might run maybe not even comprehensive, but it might just be minimal. Comprehensive would be best.
If you've never had your labs ordered by a naturopathic doctor, you're probably missing labs on your basic labs.
I would agree with that 100%.
We get labs sent to us from other doctors all the time, and they're missing so many tests that you should have tested to get to that problem.
Right. And a patient will say, all my labs were run and everything was fine. And I will say, I would still love to see those, because we look at it a little bit differently and more in depth, and then we usually add 10 more tests.
And a perfect example, not to scare you, it's more because we need the information to get to the bottom line. The perfect example of that is thyroid. Most doctors, when they run your thyroid panel, they only run something called TSH, which is basically the brain part of the thyroid telling the thyroid to make more or less.
Right.
If you don't actually run the rest of the thyroid panel, that TSH is a guess. There's no guarantee that your TSH marker will correspond to the rest of the thyroid.
Right, and there's that guessing game again.
And thyroid can lead to depression, anxiety, brain fog, a boatload of other things. And without knowing the big picture, it makes a huge difference.
Oh yeah, big time. Thyroid plays a big role in that. The other diagnostic test that you might have ordered from your traditional doctor is maybe a brain MRI, or even maybe a little simpler than that would be a CT scan. And those are valuable tests. If you have something major going on in there, we want to know. So a normal brain MRI or a normal CT scan would just rule out something major.
Yeah, exactly. And ruling major things out is important too. But when it comes to the regular labs, again, too, one of the most common labs that are not checked, even though somebody has anxiety or depression, is cortisol. And cortisol is your stress hormone. So magically, if you have anxiety, then cortisol is important to test.
Yeah, cortisol is one of my favorites. I love to get that tested, and I love to see where everybody is ranging on that. And it plays a big role in energy, but also in brain health and how you effectively work with your brain chemistry. And this is Dr. Loreena Ryder, and I'm here with Dr. Stephen Katz, and we're from the Naturopathic Physicians Group on Money Radio, 1510 AM, 105.3 FM, for your health is wealth. And we are licensed naturopathic physicians. If you feel like there's something missing with your care, or if you're tired of the runaround, come see us. We're at Naturopathic Physicians Group, 480-451-6161.
But it's so important to run the correct tests. With that stress hormone we talked about earlier, conventionally they generally run full scope. When they run their labs, they're moments in time. Some of these labs will change throughout the day. So if you don't actually get the full picture, your treatments are based on guesses again.
Yeah, and they are a snapshot. That is one of the downfalls, but it still does give you a nice general guess, I suppose.
So if you're trying to get into good diagnostics for mental health, so you're not playing that guessing game, you've got to run good tests, good general tests, so you can treat the problem, so you're not just treating the symptoms. Commercials, I love talking about commercials. I'm sure you've seen plenty of commercials on drugs and all the fun drugs that are available out there to treat mental health out there.
Yeah, they let me, after the commercial is over, I'm usually like picking my chin up because I just can't believe how they go.
The side effects, and especially the antidepressant ones, they always show somebody who's so happy in those commercials despite that they're advertising for an antidepressant. It's one of those things that I know they're doing that because they want you to think that these people are happy now. But the idea is when you listen to those laundry list of side effects, those are very real. And one of the funniest things I hear when I listen to antidepressant commercials is the side effects will say, this can make your depression worse. And you listen to that and you're like, how does an antidepressant make my depression worse? Well, that's because they're guessing with the treatments based on symptoms. If you can test those neurotransmitters, the neurotransmitters are what controls the chemical balance in your brain. If you can test for those, and there are available tests for that, you can see what you're low in. Then you can find out, is a supplement going to help you or the med? But if you use a med, you're going to know which one's the correct med to be on to get you your relief.
Absolutely. And another thing that makes me just shake my head when I hear the commercials is that some of them will, or actually most of them will, increase suicidal thoughts.
And another thing, when you treat stuff like anxiety, you have to remember that when you alter brain chemistry in your brain, you're going to affect other parts of your body. And most common drugs they use for anxiety, they are depressants. So you might be treating your anxiety, but the longer you take these anti-anxiety meds, actually increases your risk of getting depression.
Isn't that crazy? So let's talk a little bit about the traditional treatments that are out there. We'll just list off some things that you probably have heard of, you may or may not be taking or have taken in the past to treat brain imbalance. And that those are antidepressants, anxiolytics, which are anxiety-reducing drugs. There are sleeping medications. There are medications to reduce the racing brain of an ADHD diagnosis. So,
and we're going to do a whole episode on sleep soon. But when you think of sleeping medications, these are addicting meds. These are meds that if you take them every day, you're going to need them every day in order to sleep. And if you try to get off of them, you can't. It's very difficult. And in general, when you're talking about sleeping medications too, if you take them long-term as well, some of them are linked to depression as well.
Right. Yeah. So the antidepressants, I'm sure you have the same experience that I do with patients in the office, but when they are taking an antidepressant, it does help their symptoms, but they also say that they feel like a zombie. They just don't feel like themselves. They don't like how they feel. And they typically don't want that anymore in their life. So they come to us for an avenue to get off of the antidepressant and use something naturally to fix that.
I've watched The Walking Dead. That's the last thing I want to feel
right
in the morning.
Yeah, zombie apocalypse. Prepare yourself. So the anxiolytics, which are the anti-anxiety drugs, you can definitely become dependent on those because you don't want to feel that anxiety once you go off of the med.
At our next segment, we're going to talk about different naturopathic testing you can do and start getting into the treatments you can do to get your life back. We are talking today about your brain and how naturopathic medication and medicine can help keep you off of antidepressants, anxiety meds, and sleeping meds. We're not telling you not to take them if you're already on them. We're telling you to check and see if there's other issues that can be causing the problems. So if your doctor has told you that you'll need to be on your meds the rest of your life, Come see us at Naturopathic Physicians Group to find out ways to potentially avoid that horrible fate. Our treatments can help you feel better again and make you sharp again and enjoy life again. We choose the song Mission Impossible for this segment because our patients will tell us what they thought was impossible is now possible because of the treatment we gave them.
Today's topic is brain health, all things surrounding brain. If you're having anxiety, depression, brain fog, memory loss, lack of focus, ADHD, diagnosis, or fatigue, these are the things that we're talking about today.
And you said zombie syndrome.
Zombie syndrome.
Brains.
Yes. So we like to have a tip of the week every week, a little bit of tidbit of information for you to take and use to better your health. So today's tip of the week is about exercise and the endorphin and dopamine release that's involved whenever you exercise. And it's a true phenomenon. It's scientifically proven. If you go to the gym or even go outside and take a brisk walk every day, it will increase your dopamine level, which then in turn puts you in a good mood.
There's a lot of very active patients we see that are sports players, athletes, and they will say when they can't exercise, they feel depressed.
Yeah, all the time. I hear that a lot, and it really does work. I challenge you to try it.
And vice versa. Patients that don't exercise, when they start exercising, their depression and anxiety improves. Dopamine is your happy, feel-good neurotransmitter. It's also a precursor to norepinephrine and epinephrine, which is adrenaline. So exercise actually helps increase energy. Yes, it can wear you out in the beginning because you're not used to it, but it actually increases energy and time because of the way it works in the brain.
Right. It might take a little bit of personal willpower to get over that feeling of just wanting to flop on the couch or drive past the gym on your drive home. You actually need to activate some of that willpower. Come on, just go in and do it. You know you'll feel better whenever you're finished.
Plopping on the couch is not always bad.
Not always.
We all do it. It's fun. We enjoy it. TV's good too. It just can't be the only thing you do.
Right, exactly. If you can just do maybe start out with a 15-minute walk and then increase that to adding in yoga and then maybe increase that to adding in some weights. Maybe do it 3 days a week. If you only get once or twice a week to start out with, that's better than nothing. Getting started is the first step.
Now, we got into briefly some of the causative testing because we said you have to know what's going on in your brain, in your body, in order to find out what causes the anxiety, what causes depression. One test that's really important that very few people have ever heard of is actually a neurotransmitter test. I said earlier, neurotransmitters are the building blocks of your brain chemistry. So neurotransmitters include dopamine. Again, that's your happy, feel-good neurotransmitter. Norepinephrine and epinephrine, that's adrenaline, fight or flight mechanism. You get attacked in the forest by a bear, you're going to fight the bear or run away?
I would definitely run.
If you have no norepinephrine and epinephrine, you're getting eaten.
Yes. I would slowly back away first, right? That's what you're supposed to do? With your arms lifted so you'd look bigger than the bear, or would you just run?
No, I just run.
Okay.
I learned my lesson. I mean, I don't win any fight.
Oh, okay.
Work, home, anywhere.
That's good to know.
Yeah.
Thanks for telling me.
So the other ones are serotonin. That's your calming neurotransmitter. That's your relax neurotransmitter. And serotonin is a precursor to melatonin, which is your
sleep hormone.
Sleep. So if you are not balanced with these neurotransmitters, you're going to get anxiety. You're going to get depression. A lot of the medications out there that they treat depression with, these medications are serotonin drugs or dopamine drugs. Your anxiety meds, a lot of them are GABA drugs. GABA is an inhibitory neurotransmitter. It shuts down pathways. That's why when I was saying earlier, anxiety meds a lot of them are depressants. It's because these GABA drugs over time, if you use them for years and years, will actually lower your dopamine linked to depression. It will lower your serotonin linked to depression.
And we need GABA. We just need it balanced.
Correct. And GABA and glutamate is an excitatory, exciting neurotransmitter that gets the body to make more. All of these, too much is bad. Too little is bad. It's about balance.
Right. And the neurotransmitter testing that you're talking about, if you are afraid of needles and just don't like your blood getting drawn, it's really great because this is a urine test. We actually test the neurotransmitters with a collection of urine.
And when you're talking about that neurotransmitter test too, when you do this test, you actually see both sides or all of the sides of your brain chemistry. So when you see something's low or high, you can address it specifically so you'll know which medication can help you versus supplement versus diet versus, a lot of different things can be used to treat it correctly.
That's the beauty of these testing because it takes the guesswork out of how you need to be treated effectively.
And in the brain, they communicate with each other. So you're supposed to have higher levels of dopamine and norepinephrine and epinephrine. Again, that's adrenaline in the morning. But as the day progresses, that should be getting lower and lower, not to make your mood down with lower dopamine. It's just so you don't have too much adrenaline so your body can relax and go to sleep.
Right. Yeah, that's involved with your circadian rhythm of when you wake, when you sleep, which brings us to the cortisol hormone testing. That's another way to take a look at brain chemistry. And the cortisol measures what you're talking about with higher in the morning, that slope downward to a lower level at nighttime.
On a typical person, that's normal. It's higher in the morning. Now, cortisol is also, as we said earlier, is your stress hormone. So if you have too much cortisol all the time, you're probably wired all the time. And I'm sure there's a lot of people listening today where they will say, I feel like my brain never stops. I can't sleep at night because I'm constantly thinking of work, thinking of the next day. All of these things can be linked to your stress hormone potentially being elevated at the wrong time of the day or all day long.
Right. And you have the opposite issue as well, where you're just flatline with your cortisol from the time you wake until the time you go to bed. These are people who are just exhausted all the time. They could take a nap 3 times a day. It doesn't matter.
And not improve.
Right, right. The sleeping does not help. Coffee does not help.
Versus the opposite, when they're too high all day, they can't do anything to relax. They're constantly anxious and not feeling like they can just go to sleep. They can't sleep.
Right. It's a real problem. And then you also have the inverse curve of cortisol, where it's supposed to be high in the morning and low at night. But some people wake up with it low in the morning and high at night. And these are the people that consider themselves night owls typically.
And that test is usually done, I think the best way to do is through saliva. So it's an easy, you can spit. Most people are pretty good at spitting.
I think they would prefer to spit rather than get their blood drawn.
Yeah, that or the urine test again.
Right.
But don't miss.
Don't confuse them either.
It's messy. But when you do the saliva test, what you actually do is you collect the saliva over the day, morning, afternoon, evening, and bedtime, so you can actually find out that curve so you can determine the correct treatment for your condition.
If you feel like you've gotten the runaround with your doctors and are tired of just feeling in the dumps, it's time to call Naturopathic Physicians Group. Our office is located at Scottsdale 9200 East Raintree Drive. You can contact us by phone 480-451-6161 or on the web naturopathicgroup.com. Our doctors are well-versed in all aspects of healthcare, and we're ready to make you feel whole again. This is Dr. Loreena Ryder and Dr. Stephen Katz.
We talked in the last segment about the testing you can do to find out what the problem is. We talked about neurotransmitter testing. If you want to know what's causing your anxiety, your depression, problem with sleep, all those things, brain fog, a lot of them can be determined by your brain chemistry. And so a simple urine test can actually measure all of those neurotransmitters, which then you can pinpoint your treatment to you. Very individualized. And then we also talked about the cortisol, your stress hormone that you can test. When you do your blood work with your conventional doctor, they usually only run cortisol sometimes. And when they do, they usually only measure it one time. Your morning cortisol is the most common one. But it's only a part of the puzzle. You need the puzzle pieces. So when we do our testing, we do the saliva testing, and they measure it morning, afternoon, dinner time, bedtime. So you can actually find the curve of your stress hormone and find out, is this part of the problem to your anxiety, to your sleep, to your depression?
Right, absolutely. And then how do we treat these imbalances of your brain? So we at the Naturopathic Physicians Group, we will use amino acid therapy. We can also use IV therapy. We will address it using diet and lifestyle changes, or we can even test your hormones and adjust those accordingly. Now, the amino acid therapy would be individualized according to what your neurotransmitter test and your cortisol test results are. And those are addressed simply with supplementation and what's missing or where the imbalance is.
So remember, amino acids are the building blocks to neurotransmitters. We get a lot of our amino acids from eating protein. So again, diet plays a really large role in brain chemistry. And another kind of tip, or at least something to know, is that a great majority of the brain chemistry, your serotonin, your dopamine, your norepinephrine, epinephrine, your adrenaline, all the stuff we were talking about earlier, a great majority of them are actually made in your digestive tract, not made in the brain.
Isn't that incredible?
So when you eat poorly, like we talked a couple weeks ago when we got into a lot of conversations on poop, but when you eat good or eat well, I'll get in trouble for saying good in the wrong time.
Right.
But when you eat well, you have a much higher probability of having a healthy brain.
Yes. Food again. I love food as medicine. That's one of our foundations.
But when you test those neurotransmitters and you find out you're low in serotonin or low in dopamine, when you test those, you can figure out from that test which amino acids, again, amino acids are the building blocks to the dopamine, to the serotonin. You can find out which amino acids you need to take in order to produce those naturally, to help with your depression, to help with your anxiety, to help with your insomnia. It's a pinpoint treatment based on your testing.
Yes, and this is the beauty of naturopathic medicine and looking at the cause and treating the cause, because once you treat the cause, you no longer have the symptom.
And when you're talking about, well, how does it know to take the amino acids and make it into your happy neurotransmitter like dopamine or your calmer like serotonin? Well, you need nutrients for that. So again, the diet plays a big role, or knowing which supplements do that. So there's a thing out there called cofactors, and your body needs these nutrients in order to take the amino acid and build it into the brain chemistry.
Our bodies are amazing and incredible, and if they're only given the right nutrients and the right supplements, it just takes it and goes from there.
And so that is huge. By understanding what's missing, you're able to, again, pinpoint the right treatment. Now, if you're not eating clean, again, you're not getting enough nutrients in your food, so naturally the brain doesn't work well anyway. So if that's the case, or you don't feel like you have enough nutrients, can't eat well, certain things out there, that's where the IV therapies come in. You were talking about IV therapies as a way to treat. They're great for your immune system. They're great for healing. But one thing we do for the brain is we actually put in those nutrients, those cofactors, to give those amino acids the tools to make the dopamine, the serotonin, the GABA, the glutamate. You need those nutrients in order to make proper brain chemistry.
Right. And IV therapy is immediate. You bypass any absorption issues. So if you have somebody who has poor GI health, until we can get that fixed and healed, the IV therapy is a great answer.
You'll have a lot of patients say, I tried supplements and they made my stomach hurt. Well, if you have a problem in your GI tract, this bypasses, like you're saying, you go right into those nutrients to start your healing.
Right. And we talked about hormones a little bit too as a therapy or a treatment for this. Most of us think of hormones as just sexual function or reproductive function, but we have hormone receptors in every single part of our body, including our brain and including our gut. So we can test hormones as well to see if that's a part of why your brain just isn't working like it used to.
And as we age, men and women, low levels of testosterone is linked to depression, anxiety, fatigue. Too much testosterone is linked to aggravation,
right.
Yelling at people for no reason, yelling at yourself.
Right. And a decrease in estrogen is associated with, many major brain diagnoses.
Yeah, and progesterone's linked to that. And again, that stress hormone is made by your adrenals. And if your adrenals are not working, if you don't have the nutrients to help your adrenals, if you don't eat clean, you affect your adrenals. If you work 15 hours a day for 6 years, 7 days a week, you're going to, if you go through med school, you're going to be, your adrenals are going to feel tired, and you need help with that.
Yeah, and we live in the United States of America. I think 85% of us are probably adrenally fatigued.
Yeah. And hormone testing is something we can do as well. But when it comes to the anxiety and the depression, the two tests that very few people know about are those neurotransmitter testing and your full day cortisol stress hormone testing.
And bonus, you don't have to get your blood drawn. You just pee in a cup or spit in a tube.
And when you're doing, conventional treatments, a lot of times they're guessing. It's not that we're not telling you not to do them. You've been prescribed them for a reason, but you can actually find out, was that the correct medication for me? When you read the side effects of them, a lot of times you will be seeing things you're going through.
Right.
If you're on medications and you're trying to either think about getting off of them, again, there's a safe way to do it, and you need somebody experienced to help you do that.
Right, absolutely. And I just want to say one thing about sleeping pills. There is not actually a sleeping pill on the market that promotes sleep. It is a sedative. It kind of just relaxes you and knocks you out.
And the most common one over the counter is Benadryl. They might call it sleep something, but it's actually Benadryl most of the time. And Benadryl being an antihistamine, histamine is also a neurotransmitter. So long-term use of antihistamines actually are linked to a lot of different brain issues.
Incredible.
So when you see a naturopathic doctor, we're going to get to the bottom of the issues. We're going to find the cause. We're going to do the correct tests for you so you can know what actually happened to create the imbalance.
And then we teach you moving forward how to prevent this in the future, how to take care of yourself, how to be an advocate for your own health.
You want to find that root cause. And then if you don't have any issues, prevention is still the best way to cure. You don't want the problem. So understanding how to do labs correctly annually when you do them, understanding what they mean and are they testing the right things can go a really long way to preventing problems.
Right. And we use healing treatments. We don't just put a Band-Aid on it. We don't just treat the symptom. We heal the body.
We're here to help you take charge of your own health, increase your quality of life, and support your natural healing processes. It's often simple, and it works. We are the doctors from Naturopathic Physicians Group, Dr. Stephen Katz and Dr. Loreena Ryder. Please join us next week for another episode of Your Health is Wealth. We're going to be discussing sleep in detail. So tune in and learn all about why it may be getting too much.